It's a pyramidal-shaped space between the lateral part of the chest wall and the upper part of the arm. So this is the axilla. We cannot find any structure here, but you can imagine there are several structures. In front there is pectoralis major, pectoralis minor, clavipectoral fascia in front. Behind we will get some muscles. We already know the muscular attachment at the lateral or the axillary border of the scapula. We know teres minor, teres major. So, and in front there is subscapularis, we know, muscle. So, posteriorly we will get subscapularis muscle, teres major muscle, and another muscle which is taking origin from the lower 6 thoracic spines, all the lumbar spines, sacral spines, and also from the iliac crest, just dorsal to the attachment of external oblique muscle. That muscle, it has got extensive origin, and ultimately this muscle goes and straightway and there is an insertion at the bicipital groove. That means that is the latissimus dorsi muscle. So posteriorly we will get subscapularis, teres major, and also that teres major will be crossed in front by this latissimus dorsi muscle. So anterior wall, posterior wall. Now about the medial wall. In the medial wall we will get one important muscle which takes origin from the ventral part of the scapula. We know, and there is one muscle which has got attachment to the ventral part of the scapula. Actually, it is taking origin from the upper 8 ribs, and which helps in forward movement of the scapula. That is nothing but the boxer's muscle or serratus anterior. So medially, the medial wall is covered by the serratus anterior muscle, and also in the medially we will get upper 4 to 5 ribs and the intercostal spaces where we will get the intercostal muscles. And the lateral wall is formed by this upper part of the shaft of the humerus. Anteriorly, again I am repeating, we are getting the pectoralis major, pectoralis minor, clavipectoral fascia. Posteriorly, the posterior wall is formed by the teres major, subscapularis, and latissimus dorsi. Medially, we are getting medial wall is covered by the serratus anterior muscle and upper 4 to 5 ribs, and intercostal space and also the intercostal muscles. So this space is pyramidal. Apex is directed towards the neck and the entry point is by the anteriorly it is demarcated by the clavicle. Posteriorly it is demarcated by superior border of the scapula and medially by the outer border of the first rib. So this is the space and this is directed above. The apex is directed above and base is directed below. So we can reach from the thorax to the cervical region or from the axilla to the cervical region. So this canal is also called cervico-axillary canal. Cervical means neck. From the neck to the axilla, apex is directed above and base is directed below. It's a pyramid. Suppose you can imagine a pyramid here. So that is a pyramidal-shaped space. And what are the things are traversed by this axilla or cervico-axillary canal? Some neurovascular structure, that means the nerves and blood vessels. They actually enters through the apex of the axilla and it comes towards the axilla and distributed either on the medial wall or lateral wall or posterior wall. Okay. Now what are those neurovascular structures? You know that blood vessel, the subclavian artery which crosses the first rib, it becomes axillary artery. So that becomes axillary artery and it comes down, and when it crosses the lower border of the teres major, it is called as brachial artery. So through the axilla we will get axillary artery and there is corresponding vein, that is the axillary vein. So and also we will get the different branches of the axillary artery that we have some idea. It has got three parts, part 1, part 2, part 3. From the part 1, superior thoracic artery. From the part 2, that is the thoracoacromial artery. We have seen here we will find the lateral thoracic artery which is present over the medial wall. From the third part, one is anterior circumflex femoral, that is, and another is posterior circumflex. One is anterior circumflex humeral, one is posterior circumflex humeral, and the third one is subscapular artery over the subscapular muscle. So we will get all these branches of the axillary artery in the axilla. And neurovascular, that means neurons. Neurons, it is coming from all the, actually we know there is a brachial plexus which is from within the neck, and when it crosses the clavicle we can find 3 cords. Below the clavicle we get 3 cords. One is lateral cord, one is medial, there is a posterior cord, and one is medial cord, according to its position to the second part of the axillary artery. So within the axilla we will get the branches of the brachial plexus, that means branches from medial cord, branches from the lateral cord, and branches from the posterior cord. Brachial plexus in nutshell, it is formed in the neck. It is formed by C5, C6, C7, T8, C8 and T1 nerves, spinal nerves. C5, C6, C7, C8 and T1 nerves. From there we are getting the roots. The roots actually joins to form some trunks. And from the trunk we are getting some divisions, and those divisions unites at the level of the just posterior to the clavicle. We will get the cords. Round table doctor's conference. Root, trunk, root, round means root, table, trunk, division, and conference means cords. So brachial plexus, in brachial plexus we will get roots, trunk, division and cords. So in axilla we will get the cords and the branches of different cords. From the lateral cord we will get some nerves, from the medial cord we will get some nerves, from the posterior cord we will get some nerves. From the lateral cord we will get LML. Remember, LML, lateral pectoral nerve, musculocutaneous nerve, and lateral root of the median nerve. From the medial cord we will get 5MU. Remember, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of the median nerve, medial pectoral nerve, and ulnar nerve. I know it is painstaking for you at this moment, but as we will repeat, gradually it will be familiar to you. And from the posterior cord we will get ultra, upper subscapular, lower subscapular, thoracodorsal, radial, and axillary nerve. So I will show you different nerves and blood vessels which are traversing the axilla, and I will show you the different walls in the dissection, the different muscles like subscapularis, teres major, which one is latissimus dorsi, which one is serratus anterior. I will show you. I will show you the different nerves like musculocutaneous nerve. I will show you the medial root of the median nerve, lateral root of the median nerve, and median nerve itself. I will show you the ulnar nerve. I will show you the medial cutaneous nerve of the arm. I will show you the medial cutaneous nerve of the forearm. I will show you the radial nerve. I will show you the axillary nerve, upper subscapular, lower subscapular, and thoracodorsal nerves. So don't get disheartened. Just try to identify the structures. Today I will show you the different structures. Okay, just identify. Try to memorize it. Repeatedly you have to see these structures. Then you can have permanent memory in your brain. Thank you.